Dr. Malone, can you hear me okay?
Yep. Mm-hmm.
Great. I know you're not within 6 feet of me, thankfully, because we're exercising smart COVID policy here at the office. But you're upstairs at the office and I'm downstairs at the office. And we have been watching the numbers, and I've asked you every day this week to watch the numbers in Florida. And when anything significant happened, that we were going to go and do an update on Facebook just to let everybody know from a medical standpoint, from your standpoint, what's significant. And today you came down and you had printed out this page and you had all, I don't know if everybody can see this, but he had written all over it and highlighted all over it. This is doctor handwriting, so you're not going to be able to read it. But you see all the, he's actually pretty neat for a doctor. But you can see all the handwriting there off to the side. He's got numbers written down here of different counties. And then he highlighted this stuff up here. The doctor did all this here and then down here. And so, doctor, tell us why you were so excited today about this report.
Well, in the news, you heard a couple of times, hey, it's the younger population that's getting the infection. And, we're seeing these numbers go up. And, I guess some of the messages, it's not as concerning because these people are tolerating the infection a lot better than someone who's older or got some comorbidities. And really, this is the first time when I've been pulling this report every day where we actually have what they're publishing as a median age right up next to the total daily cases that are rolling in. So, I was tracking the daily cases for you, as you had mentioned there, and like for the last 5 days, it's 13, 15, 13, 24, 33 today. And, it sounds bad. And, that handwriting on the side of the sheet is all the other counties to show you what they did in one day. And, these huge leaps are really Dade, Broward, Palm Beach, Hillsborough County, Orange County, Lee, and Pinellas County. Those are the big counties, and us having 30, though it's nothing to be proud of, is nowhere near their 500 or 400 or 300.
So tell everybody, the median age was 50 to 60 at the first part of June. The median age has gone down to half of that, 27, 34, 26, and 29 on June 18th. So they're saying the median age of the person showing up with a case of COVID as of yesterday was 29 years old.
Yeah.
Right?
That means there's a whole lot of people in their teens and early 20s that are getting infected. Yeah.
But the good news is the hospitalization rate is not going up. Mm-hmm. Okay. So that means that the young people are tolerating the COVID okay. They're not getting really sick. But it does mean that it's out there, and it's out there in big numbers with younger people, which obviously if you have somebody in your family that's high risk or that's older, you want to be careful with those people. That's what we're talking about here, right?
Yeah. So if you're one of those people, those younger people now that are getting the infection, or maybe you don't even know you have it, and you're spending time with grandma or grandpa, or you're socializing with a multi-generational component of the family, anything like that, you could spread the infection to them, and they're going to be the ones who get the infection and then are hospitalized perhaps and don't do as well. So you have to still be mindful of spreading it. Whether or not I think there's a mindset of like, I don't care if I get it, I just want to get it and get it over with. That's kind of what some of the younger crew is, reflecting in some of the social activities, and that's great, but they become reckless when they potentially spread it to someone else who can't tolerate it as well.
Right. Okay, so I also have noticed that there are some places in Florida where the masks are actually required, right?
Yep, and it's some of the larger counties that we mentioned earlier, and then also down in the Keys. I think one of the mentions I saw was that masks are through at least 2021. They're expecting mask use in public, basically where you'd be within 6 feet of anybody, so inside buildings and businesses and all that.
And then yesterday in the news and today in the news, they were saying Florida may be the second hotspot now for the second, I guess, wave. And then I saw that they think by July there's going to be 130 something thousand deaths or whatever. I guess, what is your recommendation to folks that are high risk or older? I think the recommendations for younger people stayed the same pretty much. That is, look, be smart. Don't be reckless. Don't go around people because you probably are going to get it. You're probably going to have it. You might be exposed to it. But the recommendations for people that are high risk, those are the folks that obviously need to be worried about this, especially if it's out there in greater numbers with young people spreading around, because young people move around more. What is your recommendation to people that are high risk in Escambia County or that are older in Escambia County? What is your recommendation to them as far as being vigilant in regards to preventing this?
Well, if you're still, working age and have the opportunity to work from home or work remotely, I would say take that opportunity. And then any of the places where you can't distance from people 6 feet, really second guess whether or not you actually need to be going there. And if you have an alternative, like some of these food delivery services, that'll do your shopping for you and all that, I mean, take advantage of that. And a lot of them are doing it. They're going out of their way to get people to use it. So they're not like price gouging. They're making it convenient. So take advantage of that stuff. But, if it's really important to you and it's something that's imperative and you need to go to your doctor's office, for instance, it's the same thing we've been saying all along. Go to the doctor, go to the ER if there's an acute illness, like you're having chest pain kind of a thing, you get in an accident,
Right.
you gotta go for
People are still very reluctant. I've talked to several new clients this week that are very reluctant to go to the ER after their accident. They don't want to they don't want to be around the hospital. They don't want to get around those viruses and blah, blah. And then I saw a study this morning that said the cancer death rate is going to go up in the following years because people have skipped their screenings for colon cancer and breast cancer and other screenings they otherwise would have gotten, but they didn't want to go to the doctor. They didn't want to go get the screening done because they didn't want to go around the COVID. And I tell car wreck victims the same thing. Look, the hospital is probably the safest place you can go in town because they've got it worked out to where they are weeding through the people that have COVID or potentially have COVID and the people that don't. And they're segregating folks in different places so that you're not anywhere near the people that have it. And they're also being extremely careful with their sanitation process in the waiting rooms and in the exam rooms, right?
And the hospital staff and employees they're professionals at using PPE, whereas the general population is not. You hear all these anecdotes of people not wearing the mask the right way and all that. So when you're going to a healthcare facility, trust me, the people that are there are going to be protected from you, and you're going to be protected from them because of their proper use of PPE, right. Much more so than standing next to someone at a cash register line.
Okay. All right. Well, these numbers, I guess, are going up. You look at the graph, the people that have COVID illnesses and they go to the ER, that is going up. The median age is going down substantially, which is what we're talking to y'all about today mainly. So y'all be smart, especially younger folks between 20 and 50 years old. I'm barely in that category still. But those people need to be careful about who they're around because you could be exposed to it because a lot of people in this county in that age group are showing up positive. So be careful around people that are high risk. If you are in that age group and you're around an older person or you're around a person that's high risk, what are those high risk factors again?
So it's age and then obesity. And if you have any other comorbid illness like cancer history, cancer treatment, diabetics, and then heart disease. Those are the big, and lung disease. Those are the big ones.
Immunodeficient people.
Yeah, if they have an inherent immunodeficiency or one that's medication, due to like chemotherapy or something like that. But those are the big ones. And I'll remind you, like the ones that were unique to Americans were obesity, diabetes, and the heart disease. Right. Those are the ones that they didn't see those in Europe. They had those here, and so that's what they need to think about.
All right, folks, y'all be careful this weekend. We'll see you next week. Hopefully, we won't have to interrupt you with one of these updates, but we'll certainly talk to you about one of the other things we deal with. Yep. Drive safely. If you need us, you can find us on the web at zarzaurlaw.com or 855-HIRE-JOE. Take care. Have a good weekend.
All right. Thanks.
Thank you, Dr. Malone.